What's up, guys? Conrad here with another video, and today I'd like to make a part 2 in regards to a video I did previously about extreme male cosmetic surgeries. Now, many of these surgeries are not just for men as well. I suppose I'm catering to the guys. But yeah, what have we covered so far? We talked about height surgery, talked about hair transplants, talked about teeth augmentation, getting straight teeth, getting whiter teeth. What else was there? Oh, and the implants. Cannot forget the ab implants or the chest implants. You're not a real man until you had bicep implants, of course. Why go to the gym, man? If I can make an incision and pop it there, right there. I'm kidding. But what have we got next? Oh yeah, we got nose jobs. How can I forget about nose jobs? Of course, simple procedure. Well, for the surgeon, he knows what he's doing. I mean, don't try this at home. So of course, make some incisions and change the nasal structure of the bone. Sew it up. Get it. Wait a few months for it to heal. However long it takes, I'm not sure. And yeah, be good as rain. It's obviously not that simple. Anesthesia is required, I presume. And yeah, nose jobs. I mean, I think it's all down, it's all about symmetry regarding what makes someone scientifically more attractive. It's got to be like the right measurements, I suppose, according to a lot of nerds. But attractiveness, well, what makes an attractive face, I would say, is both objective yet subjective at the same time. We all have our personal preferences, what we prefer, what we like. But also you can see an attractive face and go, oh yeah, that person is objectively attractive. Does anyone else agree? I think everyone agrees with me here. Yet still, they might not be your exact type. Or, because everyone has their own preference. And you might see a Russian catwalk model and think, yeah, I suppose traditionally speaking, she is very nice looking, but maybe not for me. It doesn't make my blood boil, so to speak. And yeah, no one is perfect. No one has a perfect facial structure. I mean, I definitely don't. Would I get a nose job? Nah, I don't think it's for me. But yeah, in some cases, if someone's nose seems to be a unusual shape, maybe just a tad too big or tad too long or whatever, there are procedures that can be done to get that remedied, if you so choose. I mean, there's always, people have their own insecurities, and it's about whether they want to make the choice to actually take the plunge and do something about it. And usually the results, the perfect nose, I suppose, well, when I see a lot of these before and after pictures, so the first, the original picture before the surgery would be like really big, kind of like almost like a beak. No offense to anyone who has a nose of that particular shape. And what they tend to do is sort of make it smaller and kind of like make it more, just slightly more in the mid range, maybe tilted up slightly. Not like Michael Jackson, but you know what I mean. Not down, not up, but just kind of slightly up. Like, apparently that's traditionally seen as the most attractive looking nose. But on the scientific standpoint, I mean, they do the measurements, they try to get it, exactly the way that is pleasing to the eye. And you can see some people, they have a lot of potential. The plastic surgeons will look at the face and, the eyes and the mouth, yeah, it looks good. And they would adjust accordingly, the nose, in order to complement the rest of the face. So, moving on to scalp micropigmentation, SMP. So this is for the bald guys. It's more of it's another hair loss solution, I'd say. They say, all right, I don't want to get a hair transplant. I don't care about hair. Just shave it off, but I want to have the appearance of a good hairline, of a buzz cut, like a really close buzz cut. And this will be done by small pigments done on the outer layer of the scalp. So the color, very tiny individual, sort of like, almost like tattoos in a way, which would be in a shade that would resemble your hair color. and that would look good for the rest of your complexion. And yeah, I see a lot of people have this procedure done to them. And do I say, does it look good? I suppose it's way less intrusive than hair transplant, probably less risky, a bit more safe. I mean, don't quote me on that, but just for appearances, it looks less messy. Put it that way. I'm not saying that I'd recommend that you need to get one, but it's a it's a solution for many people. The only thing is that it's a fine art. It's not. It's actually. It is like a surgery, but it's more. Yeah, I would say it's more like an art form rather than a very intrusive, invasive surgery that requires cutting and like opening up the body in that way. So yeah, it's just about everyone wants their procedure to look as natural as possible, and that's where the real art comes in. So the hairline would obviously, they want to make it look natural and a good height, let's say, and a good shade, because I've seen people with this S&P procedure and it just looked too dark and it just doesn't look natural. So if it's sort of faded, not very concentrated, not too much contrast, but sort of faded, and not too dense. And that's probably the key, really, because you can see if it's almost like it's painted on hairline. It just doesn't look good. Like it's almost as if you took a felt tip and it's painted the whole thing on your head. So it is I suppose, a good solution. Just brings about the illusion of symmetry and nice buzz cut, so to say. Not a real buzz cut, but can look good. So that's up to you whether that's something you want to consider. The next thing, I mean, this is not considered surgery really, but it's just tattoos. Should the guy get a tattoo? I mean, of course, that's up to him. Get a cool tattoo, something that's meaningful, something that's quite artistic. Obviously, it's gonna, the more beautiful the tattoo, the more recommended the artist, probably the more pricey it's gonna be. I myself, I'm not really a big fan of having tattoos myself. Just want to keep everything as plain as possible because I'm boring like that. I'm afraid that if I get one tattoo, I might regret it later. It's not going to be, it might be referencing a special time in life or something I really want to remember. Put this name here, or put this quote, put this shape, because it really means something to me. An event has happened to me, and I'm going to mark that on my body for life. I know there's laser tattoo removal as well, but still I'd rather not take the risk because I'm very not whimsical, but I'm like, I commit to one thing and then the next day I'm like, I changed my mind. So yeah, that's the one thing I'm afraid of. I get something done, I'm like, you know what? I'm not feeling that same way about that quote or that name or that thing. I think I've changed. I've moved on. And that's the thing. People grow up. They change their mindset. They're not even the same person. So that tattoo might not have the same meaning to them anymore. Maybe not. Depends what you choose to get. So yeah, that was my thoughts on a couple more procedures done in order to make one look more attractive. If that's what they think is more attractive. Anyway, that being said, hopefully you enjoyed this video. Thank you very much for watching, and I'll see you guys next time.